Um, this webinar is part of an effort to really talk about why we need to preserve antibiotics. It's very clear for many of us that there is a silent pandemic that we are today faced with. It's as grave a threat that we have as, say, climate change or the COVID-19 crisis that we are dealing with. I mean, just think about and I'll put it in very simple terms, the extremely frightening prospect that the medicine that we need that will make us well is just not effective. I mean, this really makes the whole prospect of disease, of ailments, of just, how will we ever get well? And if you look at this in terms of antibiotics, which have been such an important part of the modern medical system and have saved so many millions of lives, billions of lives, that you need to talk today seriously about what do we do to make sure that this antimicrobial resistance, the prospect that the medicines that we need are no longer effective, does not happen. And if you look at it in today's context, and I think for most of us, I mean, we've talked about AMR for some years, but never when we are sitting in different parts of the world, but are enjoined with one crisis, which is COVID-19. I mean, today the entire world has been brought to a stop because of a small virus. And we are all awaiting a vaccine which is going to fix it, because we know that without a vaccine, we will remain vulnerable. Now think about this particular prospect and danger when it comes to the medicines that we know today, the medicines we need today. And if they are no longer effective, I mean, just how absolutely catastrophic that situation is. So just like you have the discussion on climate change, the catastrophe that awaits us, the AMR, antimicrobial resistance, is an equally important global emergency. It's a health emergency. It needs to be understood by all of us so that we can take the actions that are required, that governments can take the action, that industry can take the action, and that we can actually make sure that this frightening prospect does not ever come true. And that's really why the WHO and FAO have, the UN organizations have come together to talk about this in terms of a week of awareness creation. And that's where we are today. And that's what we are trying to do, is to make sure that we can all understand both the current crisis, the challenges, but also the way ahead. That's the conference, the webinar for today. Let me do a quick briefing in terms of the speakers and the order of and how we will organize this. We have some extraordinary important speakers, and we are all looking forward to hearing them. So what we're going to do is to take the first set of 3 speakers, which is Haley Getahun. Dr. Getahun is the director of the Global Coordination and Partnership at the tripartite between the FAO, the OIE, and the WHO Joint Secretariat on AMR. So he is the head of the tripartite. We will ask him to speak first and talk about why AMR, what are the concerns and what are the containment by WHO and the tripartite and the initiatives and challenges. I will then ask my colleague Amit Khurana and Rajeshwari to give an overview of the challenges as we have seen them from the developing country perspective, particularly, and also the connections between environment and health. We are, and food and health. We particularly, we want to make sure that we can bring to your attention the fact that the antibiotic misuse pathway is not just through human beings, but also through the food we eat and through the environment. And that is a top concern that we have, and we want to talk about that. I will then turn to Keith Sumpton, who's a Chief Veterinary Officer at the FAO, and his colleague, Ms. Song. And they will talk about how FAO is working on eliminating misuse in food and agriculture systems. As I said, that's our top focus, to be able to understand that. I will then, in case there are questions for these three speakers, I will then take them so that we can have a brief interaction. I will then move directly to discuss with three key speakers that we have of country and state initiatives. Because at the end of the day, we know that if you need to implement an AMR action plan, it has to be done at the country level. It has to be done at the state level in India. We need to implement policies so that these are grounded. And that's where we will ask Ms. Kapuna to speak. She is from Zambia, and the lab scientist and in charge of the AMR National Focal Point and Coordinator. I will then turn to Sekasai Zenuvera, who is the National AMR Focal Point at Zimbabwe, and Ms. Sarda Devi, who's the professor and head of department at the Medical College in Kerala, who is involved with the Kerala State Action Plan. We will then, again, I will open it up to some questions in case you have, because we will understand from these three practitioners and policy heads, how are they looking at it from their country perspective, state perspective. I will then come back to the issue of environment and the issue of livestock. And we have two very important speakers. We have Will Gaze, who is the professor of microbiology at the University of Exeter, who will talk about the environmental connection to AMR and how we contain that. And then we have Girish Sharma, who is from NDDB. And as you know, NDDB is one of the top dairy producers in India, and we need to understand how they are bringing these practices in and what will they do to make sure that they will reduce and hopefully eliminate antibiotic use in the dairy sector. So that really becomes the discussions for today. So once again, welcome all of you. And I would now request Dr. Getahun to give his talk, because he is in a very interesting position where there is the entire week, and we need to understand what is the world community going to do to combat this threat. Dr. Getahun.
Thank you very much. So let me try to share my screen. Can you see it?
Yes. The slide is still not visible. Can you come to your second slide and do full? Okay. Yes, perfect.
Now you can see it. Okay, thank you very much, Sunita, and thank you very much, everybody, for your time. Just before going into my proper presentation, I would like to bring attention, as this is the World Antimicrobial Awareness Week, which used to be called World Antibiotic Awareness Week until last year. And the transition for this year from antibiotic to antimicrobial was based on the experience we garnered over the last 5 years and the focus on antibiotics, and knowing that actually the drug resistance problem is not restricted to antibiotics, but it also covers the whole range of medicines that are essential for humans, animals, and plants, including antivirals, antifungal, and antiparasitics. And we had a discussion, actually a broad-based multi-sectoral consultation that we organized as a tripartite, WHO, FAO, and OIE, in May, where there was overwhelming consensus and agreement to move from the focus of the campaign to move from antibiotics to antimicrobials. Basically, number one, to cover for all drugs and medicines that are critical for the life of beings. And number two, it could also help to seek efficiency and synergy between sectors and also between stakeholders in order to advance the cause. And more importantly, what we also did was we fixed the dates. As you all remember, in the last 5 years, the dates were not fixed and they were changing every year. As far as there is November 18, somewhere in the middle, and it is between Monday and Friday. But the tripartite director generals in their meeting, and also as part of our move to shift into a broader engagement of all stakeholders and to make wow everybody's business, they agreed to fix the dates always between 18 to 24 of November. And this will also create an opportunity actually to reach out to critical stakeholders. For example, yesterday was World Toilet Day, and it creates an opportunity to highlight why water and sanitation and prevention of infection is critical tool also to mitigate and stem antimicrobial resistance. And today, November 20 is also World's Children's Day, Universal Children's Day. And this also creates a good opportunity to reach out to children, and any effort about the future of children without addressing antimicrobial resistance is also incomplete. So this shift in general facilitates this new way of working across all the sectors. So I want to highlight that before I go into my proper presentation. So as we discussed in the past, the tripartite organizations have stepped up their efforts to address this complex challenge of antimicrobial resistance. And the tripartite joint secretariat on the antimicrobial resistance is now established more or less for a year. And this was done following the request of the Secretary General of the United Nations upon his receiving of the report of the Interagency Coordination Group, and also following the commitment of the Directors General. And this Secretariat is based in WHO, and it has also liaison officers and dedicated staff from FAO and OIE. And its key functions is to show the OneHealth, that means the multi-sectoral response for this crisis and challenge is well coordinated by these three organizations, as the mandate also lies into these three organizations. And one of the key outcomes of the Interagency Coordination Group is also to bring back the mandate of WHO, FAO, and OIE in responding to this crisis. So this secretariat is in charge of making sure that expectation and that challenge is also well addressed. In addition, we are also, the secretariat also hosts the global, the governance structures that are being established, which I will address. and also the multi-partner trust fund of AMR, which is targeted in bringing impact and results for country level action by working together, by showing that the One Health response is coordinated and activated to address impact and result in countries. So for my presentation, I will focus on key collaborative products of the tripartite. One is global governance structures that are being established. Another one is international instrument on the use of antimicrobials in humans, animals, and plants, which we just released today. And also a little bit brief about the trust fund. So to start with the global governance structure, as you all may remember, one of the ISCG recommendation was to strengthen the global architecture of governing and responding to the antimicrobial crisis. And they recommended the establishment of 3 structures, as you can see on this slide. The first one is a One Health Global Leaders Group. The second one is an independent panel on evidence for action, and the third one is a partnership platform. And these structures are meant to strengthen the global response across the whole spectrum of One Health, in the animal health, in the human health, in the environment, in the feed and food production sectors. And these structures, actually, they are very complementary, as you can see, and this is also available on our website, how these structures, what is their purpose, what is their focus and emphasis. And this is to show that we need to first have the political leadership at a higher level, and also we need to have the technical expertise and also the assessment and evaluation of the evidence that is available to guide policy options. And the independent panel is established with inspiration from the independent panel on climate change. So this could really help in an independent evaluation of the evidence to guide for policy options. And the partnership platform is also intended to bring all stakeholders. We can't really address antimicrobial resistance by only dealing with one sector. So this platform, this partnership platform, is intended to bring shared vision and shared goal that will bring all stakeholders and agree and move in issues that are of shared value.
Haley, sorry to interrupt. Can you just turn it into the slide mode? I'm getting a lot of comments from people who are not able to see. Yes.
Like this?
Perfect. Thank you. Sorry for
that. So the other important launch that will happen in 3 hours' time is establishment of the One Health Global Leaders Group on antimicrobial resistance. And this is one of the key recommendations of the Interagency Coordination Group. And this was also prioritized by the UN Secretary General in his address to the tripartite organizations and their DGs to facilitate its establishment. And we have developed the terms of reference, and there has been quite substantial public discussion around the terms of reference, including with member states and civil society and the private sector. And then once that it is finalized, the Secretary General delegated the establishment of this leaders group to the Director Generals of the tripartite. And once that delegation is granted, we have again make an open call of nomination for membership, and we have got quite enormous interest from member states as well as from civil society and the private sector. And after very careful consideration for the representation across all sectors of the One Health, animal health, environment, human health, and also the industry, the food, and the private sector and civil society. We are ready now to launch today the establishment of this leaders group, and we are very much excited by the level of interest by high influential political leaders, as well as civil society and private sector, that will really help this advisory and advocacy role of this group, particularly for the tripartite organizations, which are mandated to coordinate this global response for AMR. And the launch will be 3 o'clock today, Central European time, and you can follow it live. It will be live streamed. The other important product that is being launched today is also the international instruments on the use of antimicrobials across the human, animal, and plant sector. As you may remember, the 2016 political declaration on antimicrobial resistance had one recommendation that required the establishment or the development of a stewardship framework on the development and use of antimicrobials, as well as vaccines and other commodities, with the anticipation that eventually we may have a global treaty that will guide the use of antimicrobials in general, in our food, in production, in our health, both animal and plant health, and other systems. But the experience over the last 4 years, particularly with member states and the negotiation and the discussion, the challenges were enormous. So what has IACG had also discussed the challenge and analyzed the barriers and the bottlenecks, and what came out was to look first a stepwise approach where we can actually look into those standards and guidelines and tools that have been already agreed for implementation by member states, and to move forward in implementing them, and through time see the challenges and also the enablers of implementation, and see also the possibility of having a global treaty or code of conduct or whatever in terms of governing the use of antimicrobials. So we have this document released today, which actually looked very in a restricted manner the use of antimicrobials in the whole antimicrobial life cycle, as you can see on this slide. And starting from production, regulation, and procurement, and the appropriate and prudent use, and then the disposal. And we have also worked on this one with the UN environment. So we believe this tool is critical, particularly for civil society organizations, to bring governments and other stakeholders to accountability for implementing for these standards and instruments which they have already agreed. And lastly, very briefly about the Antimicrobial Resistance Multi-Trust Fund. This is, as I mentioned, is a trust fund to help the joint activities of the tripartite, i.e. addressing the multi-sectoral response. And we have the generosity of the governments of Netherlands and Sweden and the UK, which raised $13 million, and which is helping nearly 11 low and middle countries to show country impact and result by working together. And this, in some countries, the proposals are also supporting and working with non-governmental organizations and civil society organizations in addressing this broader spectrum. And we are hoping the experiences garnered through the implementation of these programs, both at country level and at the global level, will also help us to move our global collaboration into action. As Sunita, you said earlier, all this, if it is not translated into action at national level, at subnational level, and at district level, it makes no sense. So this is what this trust fund will help us achieve. Thank you very much.
Thank you. Thank you, Ailey. That was very good and gives all of us a very clear idea of how the world is moving. I have some questions for you, but I'll come back, as I said, after I have 3 presentations. I will now turn to Amit and Rajeshwari. I think, Rajeshwari, you are making the presentation today. It's a joint presentation from CSC, so please go ahead.
Okay. Am I audible?
Yes.
Good afternoon, everyone who's attending this webinar from India. I am Rajeshwari Sinha, and I'm speaking on behalf of CSC as well as Amit, my colleague, who's not been keeping well. So at the very outset, let me just mention that this webinar is a part of the Act on AMR initiative that CSC is doing as part of the World Antimicrobial Awareness Week 2020. And as part of this initiative, we have been engaging with a lot of global experts through contributed articles, video conversations, as well as today where we are engaging with some of them to understand the need for OneHealth action to contain antimicrobial resistance. Going forward, of course, this is a week where we are talking about the need for creating awareness, but we should also understand that the crisis of antimicrobial awareness, antimicrobial resistance is such that it is a chronic pandemic of huge cumulative damage. An estimate a couple of years back suggested that about 700,000 deaths are occurring every year due to drug-resistant infections. And if we do not act, this could jump to about 10 million deaths per year by 2050. Now, when we come down to estimating this lives at risk per day or lives at risk of death per hour, it comes out that about 27,400 lives can be lost per day, or 1140 lives can be lost per hour by 2050. And this is even much more than the damage that COVID-19 is causing us, which is roughly now about close to 5,000 deaths per day that is there globally. And more cause of concern is 90% of these deaths have been estimated to be attributed to developing countries, particularly in Asia and Africa. This chronic pandemic has been there for long. It has been causing deaths for many years across all countries and age groups, and will continue to do so unless we act now. And silent because it does not invoke the panic around the damage that it causes. Its potential of causing huge impact is very clear from the fact that antimicrobial resistance can affect the outcome of all kinds of bacterial infections. And with existing antibiotics becoming ineffective and pipeline for new antibiotics remaining dry, we have all cause for worry. Having said this, we all understand that this AMR is a One Health issue and is contributed by multiple factors under human health, animal health and food animal production, waste and environment and crops. Issues like self-medication, not completing the suggested dosages, overprescription, over-the-counter sale of antibiotics in human health, the routine antibiotic use for growth promotion or disease prevention in intensively rearing food animals, as well as the use of critically important antibiotics meant for treatment in humans in case of food animal production, improperly managed waste, particularly from the AMR lens, coming out from farms, factories, healthcare settings, as well as community settings, and their linkages to even the larger environment, as well as the use of antibiotics in crops as fungicides, are areas of concern which contribute to the issue of AMR. And amidst all of this, the focus of CSC over the last decade that it has been working on has been on the animal health, food animal production, and the environment, as well as the plant part of it. given our experiences of having worked in India and engaging with other countries, particularly in Africa, we have seen that the misuse of antibiotics is also a problem in India. And we have been able to document our experiences from the ground in case of antibiotic use in apiculture, in rearing poultry, in aquaculture, in the dairy sector, the use of antibiotics in crops, in feed, as well as in fast food supply chains. And in addition to this work that we have done in India, CSE is also working with the government of Zambia to support the implementation of its multi-sectoral national action plan on antimicrobial resistance. And as part of our work, we have engaged with Zambia to develop a couple of important policy documents, such as the prioritized action plan, a baseline information and framework for integrated surveillance, and a roadmap to phase out misuse of antibiotics in food animals in the last 1 year. And currently, we are engaging with the Environmental Management Agency in Zambia to develop a framework for drug take-back program. Similarly, we are also engaging in Zimbabwe with the government of Zimbabwe to support the implementation of their national action plan. And we've already had a media workshop for awareness creation among journalists in Zimbabwe, and a workshop on implementation status, understanding the implementation status, and helping prioritize the action plan. We're currently working on developing this prioritized action plan. Fortunately, we're going to hear both the national AMR focal points of these countries today talk to us. Now, having given this background, it's also important to understand that this is 2020. The Global Action Plan released and was adopted in 2015. It's a little more than 5 years that it has been adopted. And it's time to take a look back and take stock and see what was planned and where we have reached. And given our work and what we have experienced as we engaged with stakeholders, we understand that the issues that arise and reflect the need for a true One Health approach is yet to be met. And these issues include that national AMR action plans are struggling to move ahead as planned. And there is still a line of apprehension among animal sector stakeholders with regard to reducing antibiotic misuse in food animals and limited buy-in from them, and environment remaining the weakest link. Very quickly, if I take you through these concerns, in terms of national action plans, we understand that the issue is still largely driven by healthcare ministries and sectoral stakeholders over and above the other sectors. That's more because the main agenda of protecting human health aligns very much with the AMR agenda, which is often called a public health threat. And also, there are more trained human resources in the human health space, and stronger and active presence of human health experts over and above other stakeholders. But this has led to limited support and buy-in from other sectors such as the animal health and environmental management. Another issue which we have seen is that the issue of lack of dedicated budgets allocated by any country government for addressing AMR, which creates dependence on donor agencies, and we see that the political commitment being talked about remains largely on papers. As such, the issue has remained a human health issue despite efforts being made to push it towards a One Health agenda. In terms of the animal and food animal sector stakeholders, the concern is that there is apprehension of rearing food without antibiotics. A strong and continued belief that intensive food production system is a solution to meeting the food security concern, as well as the lack of a systematic effort to sit down together and make a case of producing food without using antibiotics and involving other approaches such as biosecurity or good animal husbandry has not really been there. And also we can say that farmers have also become trained to think like this. But what has this led to is that currently there are no plans to mitigate the risk due to transition, moving from an antibiotic way to a non-antibiotic way. On one hand, alternatives and intensives are not pushed forward, and the other, there is limited awareness on growing food without antibiotics among the farmers. As such, the use of non-therapeutic use of antibiotics, such as for growth promotion and disease prevention, and including the use of critically important antibiotics, remain a common practice. We are still able to find antibiotics over the counter, and farm-based management, particularly through the AMR perspective, is still missing. When we come to the environment, our understanding is twofold. One is at the global level, of course, there is recognition, and the UNEP has been, the United Nations Environment Program has been roped in a couple of years back now, but it's still in its stages of infancy, and the role and contribution is yet not clear. Technical guidances on how to manage the AMR from the waste as well as environment, or how to set discharge limits of antibiotics in waste is not there as of now. And the scientific community is engaged in research on environmental issues such as transmission pathways of AMR. But there is hope at the country level as far as we have engaged, and countries have shown keenness, come forward and shown keenness to address this issue, primarily because there has been limited competing interest as much as in case of the food animal sector, where the focus is more on productivity. And once again, the overall mandate of not allowing any chemical to pass into the environment aligns well in case of antibiotics too. But this keenness is again marred by challenges because there is limited understanding on how to move forward, what to do, what are the next steps. And also there is lack of capacity and funds to carry out, for example, testing of residues, which is quite resource intensive. But we also understand that this AMR in the environment is a cross-cutting and complex issue, considering that waste is emerging from several point sources, like I said, farms, factories, households and communities and healthcare settings, and they're entering into the larger environment, so much so that the environment becomes a source as well as a sink, both of AMR determinants. Moving forward, having said these, having outlined these issues that we have faced, we would like to mention that there are big changes needed. And in the animal sector, the very important thing we need to consider is that countries need to manage the way food is grown differently, rethink the relationship, how it is grown, and what could be its overall impact on us. Towards this, a ban on use of antibiotics for growth promotion in food animals and restriction of antibiotic use for mass disease prevention should be considered. Most importantly, the use of critically important antibiotics in animals should be limited, particularly the highest priority ones, which are meant for human use, should be preserved at the very outset. Uh, we should also aim to reduce our need for chemicals by focusing on better animal husbandry practices, better biosecurity, alternatives, diagnostics, and improved veterinary extension systems, and also consider growing more food in other settings and reduce this dependence on intensive farming systems. Waste management from farms equally goes hand in hand in the animal sector. The big changes needed in the environment sector involves that an AMR-centric waste management approach is adopted at the global and national level. Necessary policies and guidelines are developed, technical guidelines are developed, which help people execute things on paper. Surveillance of waste and effluents in view of AMR determinants like residues, resistant bacteria, and as well as genes in the environment are carried out. Standards for antibiotics in waste should be developed wherever necessary. And here I must say that any antibiotics in waste which is emerging from a commercial entity, we must start considering it as a hazardous chemical. At the same time, the capacity of environmental regulators at the national level should be increased and strengthened, and necessary resources and lab infrastructure support should also be put in place along with this. Last but not the least, while evidence is building up, action should not wait. The precautionary principle must overrule and action must be taken. Thank you.
Thank you, Rajeshwari. Thank you, Amit, for this presentation. I will now turn to Keith Shamsun. Keith is the Chief Veterinary Officer, leader of Animal Health Program at FAO. And Keith, can I now request you, I think a very important part of the effort, as Rajeshwari and Haley have outlined, is really what are going to be the strategies that we can get farmers and poultry owners and large aquaculture owners to actually start adopting. Yes, please, Keith.
Thank you very much. I have to apologize that in the rush of every event taking place today and this week. I didn't specifically address the question that you at a very practical level, but let me perhaps we can do that also in the chat in the discussion that follows this. So I focus more on the approach to the challenge of the use of antimicrobials. So firstly, I think it was really an excellent couple of presentations so far, and there's much that is in that needs to be discussed. FAO's action plan really relates to the use of antimicrobials but it comes under a global action plan. So it is a part of the action plan together with the tripartite. We've come up with a new action plan in line with the global action plan, but covering food and agriculture, and that is with two major goals: reduce AMR levels and slow the emergence and spread of resistance across the food chain in all food and agriculture sectors, but also to preserve the ability to treat infections to sustain food and agriculture production. The major 5 areas where we are expecting to have outcomes are really in these 5 ones here of stakeholder engagement, surveillance and research being strengthened, but focusing perhaps the practical level on good practices preventing infection, responsible use, and then the governance and allocation of resources. But if we're going to be practical, then those areas of good practices and responsible use are really ones which have to take place at really every level. So those good practices, and this is just general to our approach, which then has to be supported at country level and with those international instruments. Really, it's already been mentioned that if we're going to reduce the use of antimicrobials, we have to reduce the drivers behind it. And those drivers include the fact we cannot escape that there's a huge health inequalities in this world, in the animal health sector, between countries which are essentially with a very high animal health status and those who have far more challenging conditions in which antimicrobials are used really in treatment. Let's not talk about prevention here. They're used very heavily in treatment. So when we have major animal diseases like foot and mouth disease, very major problem in many countries, what do farmers do? They seek to treat their animals for mastitis. They try to get themselves back on their feet. Now that's a major driver. So if we are going to do something, we have to do something about reducing the drivers for use and giving people an option, an alternative, something that they can go to. So antimicrobials have become available, but advice and guidance to find another way and services to provide them with prevention by vaccines, for example, that's major. So one of the things we have to do is to mainstream the fight against AMR into the fight against the animal diseases themselves. So let's not forget that. Diseases in animals are really quite devastating. If animals survive, then they may well be treated with antimicrobials. So we have to prevent those to start with. So reduce the burden is one of the major things we must do. And the second one is the area of improved stewardship in this domain. So already there have been some move over the years to establish the appropriate legal frameworks for the access to antimicrobials and their use in different sectors. But countries are still many countries are still at a relatively low level yet. Some of them, a number around 40, do not have policies yet that are appropriate regarding the use of antimicrobials in growth promotion. And in many others, the access, even though the legal framework may be there, the access to those antimicrobials without prescription, without advice, is still far too easy. So as part of that, we have a range of field activities that we and guidance that we give to countries. The awareness campaign's already been mentioned. I don't need to say it again. We're here because of World Antimicrobial Awareness, and that's great what you're doing. In terms of work in the field, the major area of our interest is behavior change. So beyond legislation, how do we change behaviors relating to the way that antimicrobials are are accessed, used, and the way that people consider as livestock farmers or in agriculture that it's almost part of the normal business to use them. How do we change that to a different, more responsible attitude? Well, we have to think of the value chain in which those antimicrobials reach. There are millions of people involved in the value chain of providing animal health. They have significantly an income often from sale of antimicrobials. So we are now impacting on livelihoods in the value chain. That will require changing both the livestock farmers in the way that they consider the need, but also we have to impact those value chains of delivery. So there are technical resources coming from a range of countries that we make available and guidelines which we provide. Perhaps sort of getting to the how do we really make a difference? Well, one of the areas has been on the legal method, the legal status for controls in the different sectors: environment, agriculture, human health, and we provide assistance to countries on that. Another one is really a major tool for country use is the progressive management pathway. Now, this is a way of countries self-assessing where they are on these 4 major areas of awareness, evidence, practice, and governance. And we have countries involved in this pathway, and that's a way of, as I say, self-assessing where they are and whether they need to move to next to get to a better level of management. So that's a tool that we are rolling out in different countries as part of this global work. So I'll summarize very, very quickly now in terms of, I think Haile has already mentioned, we have this strong tripartite collaboration. FAO's role is largely in these areas of environment, fisheries, plant production, feed, and animal health. That is major. The Trust Fund is something already mentioned, and the Global Leaders Group, wow, it's something that is likely to really help us with how do we actually make these kind of political commitments at every level, and we make them in a way that it also can be transferred down into a daily change in the work that we do. So finally, going beyond what it says on these conclusions here, I would say, let's recall that antimicrobial use differs enormously between regions of the world. There are regions like Asia where the level of antimicrobial use in countries is way higher than it is in African countries or in Europe. So there are strong regional differences, strong country differences in the use of antimicrobials. It is not the same problem in every country. So we have situations with a very challenging disease status, but antimicrobials are not so much used. So it's not all bad in the world of, let's say, livestock and agriculture, but it is a very challenging disease status that we have anyway, and we have to address OneHealth by looking at the health of animals as part of the solution. Thank you.
Thank you, Keith. That's very interesting. I'm going to now open it up to a few questions, and before I do so, Keith, I think one of 2 big questions that we will have to, and I look forward to discussing them with you at some point. I mean, for us, there are 2 concerns that we are seeing here. One, it's not just about high and low in terms of safety and condition of animals. We're actually finding that the chemical intensive animal production is an equal challenge as much as it is in terms of disease prevention when there is very poor countries. So it's an enjoined challenge that needs to be looked at both in terms of the character of agriculture and livestock rearing that we are working towards. And of course, then the threat of animal disease for poor livestock managers. So I think that's going to be one part of the conversation that we increasingly need to have. And that's also where the whole question of the solution will come between the countries which are already intensive users and those that are not. because the ones that are not intensive users of antibiotics and antimicrobials in the livestock sector will become as they get richer and more affluent. And so the question today is, how do you make sure that we don't go through the trajectory? I mean, CSE has done a lot of work on pesticide, and I find the two are they're almost on the same level. Of course, antimicrobial resistance is a much greater threat to humanity, and that's something that we need to recognize, therefore, the pathway. But fascinating, and I really look forward to our discussions further, particularly with colleagues from NDDB who have done some very interesting work to look at mastitis and how you could deal with it without the use of antibiotics. I have a few questions that I'm going to jump into. I have a question from Vijaya Nunna. Haley, if I can point to you on this. What are the strategies implemented by the Tripethite Organization to contain the COVID pandemic? Is there a link? Are you also looking at it? So if you could respond to this.
Yeah, so probably I think Keys can also add into that, particularly around the collaboration of FAO, WHO, and OIE in terms of investigation of the source of the pandemic, and as well as also how to intensify the already existing collaboration between these three agencies to keep the transfer of infections, between humans and animals. So probably, Keith may have more information on that.
Keith, would you like to respond to that as well?
Sorry, I missed the question itself. Could you just
I'm
repeat?
so sorry. The question was, what are the strategies implemented by the Tripethite Organization to contain the COVID pandemic?
Okay, that's so I think this is really a whole UN approach. So there's a crisis management team at the whole of the UN level, which brings together the heads of all the UN agencies. So it's well beyond, let's say, this is dealing with the pandemic itself. Now, with preventing the next pandemic, there are already there are critical things that need to happen, and they're again probably wider than the tripartite itself. So they largely focus on preventing those initial overspills of infection coming from animal sources into humans, because once community transmission has started, as we've seen, it's extremely hard to stop. So we have to focus more on prevention, and prevention is working in the environment. It's working on the how people live, keep their animals, trade within those settings. So that this is beyond the tripartite, but the tripartite is central to that discussion.
And I think Haley mentioned it in terms of the World Toilet Day as well. I mean, there's such a clear connection there between COVID, clean water, infection, and then, of course, the use of antibiotics and the preventive use of clean water, both in terms of COVID as well as much about the reduced use of antibiotics. I mean, in our countries today, dirty water still remains the biggest killer of babies, which is completely unacceptable. And when we come to COVID-19, we're also told that we need clean water to prevent infection. And that the fact is, you cannot have clean water if you do not have safe sanitation disposal systems, because most of the water in our part of the world is contaminated because of excreta. So I think these connections that we are beginning to make with the preventive agenda, and I think Haley and Keith, as well as Rajeshwari and Amit, you have really emphasized this, that what we are really talking about in some senses many years down the line is to talk about prevention, not just the cure. And we're bringing that agenda back much more centrally when we discuss this. So I think thank you for that. I'm going to now turn to a question from Evelyn. Is it true that countries are struggling to move ahead with their national action plan? Sustainability and resourcing beyond initial partner investments is fundamental. Knowing that the actualization of NAPs is resource intensive, how should we move forward? Haley, this is a very important question. We have partners here from other parts of the world, and I think this is something that they're all struggling with. How do we resource, where are the resources for this?
Yes, I think this is an important point, and it is also the elephant in the room. In order to intensify our response, in order to mitigate and prevent the next pandemic, we need to invest today. And AMR, particularly those activities or actions that require funding at country level, there is huge lack of resources. One example is in the latest tripartite survey of countries, 138 countries reported that they have a national action plan. But it was only 20% of them that they said there is funding linked to that. That means 80% of the national action plans are actually documents shelved somewhere. So this is the biggest challenge. And as you also remember, Sunita, this was also debated and discussed during the ISG, whether is it good time to call for a dedicated global fund for AMR or not. So that has been discussed, and the appetite during those days was nobody was interested yet to pay for anything new funding. So we plan different ways of what we call the AMR lens to look what is already existing, particularly in investments, so that they can address the transmission and creation of drug resistance, just like what climate change is being used. But even for that, we lack the actual data. For climate change, there is a certain bar that shows that if you invest this much, the reduction in temperature will be like this. But we don't have that benchmark for antimicrobial resistance. So it's a little bit complex, but the need for new resources, the need for leveraged resources is immense. And one important role that can be played is by civil society. For those of us who come from different successful health programs, I've been working for more than 15 years in global TB and HIV programs. One of the main enabler of resource availability in those programs was the civil society, the movement of civil society, the activism, the advocacy that pushes for this agenda item to be high on the political agenda. So I think the civil society can play a huge role, and also with the way now we are going with the establishment of the Global Leaders Group and also raising the profile of antimicrobial resistance at the highest level will also help. And also the COVID pandemic. Now, I think the world is understanding that health means economic development, and economic development will not exist without health. So I think if we articulate our advocacy messages, if we articulate our activism and advocacy, I think we will address this issue. But I totally agree, this is a big bottleneck.
Thank you, Haley. Thank you for being so clear, so frank about this. I think this is really something. I'm going to now, Amit and Rajeshwari, in case you want to answer this question about food and chemicals. Is it possible to be on one side or the other? A very quick answer. Amit, can I ask you if you're well enough to answer that? I think the whole question about, can you actually, is it one versus the other, or is there something in between that we can work on? And if you can answer that, and then I'm going to actually move to the other three speakers and I will explain what we will do next. Amit?
Yeah, so thank you, Sunita. So clearly, in my view, balanced approach would be the way to go. And the solution lies somewhere in between. And I say this because our understanding of interacting with stakeholders is that there's already so much of antibiotic misuse, which is happening either because of ignorance or a bad habit, or just because a commercial enterprise told them to do so. In many cases, complete lack of awareness. So it's just figuring out what is going wrong at its first place and remove that part will actually help address a lot of the problem. And that is where I meant by saying balanced approach. I know it would be difficult to straight away jump to reduce the dependence on the intensive systems, but clearly within the current settings, by following good animal husbandry practices, by adopting alternatives, by figuring out what works best with reference to biosecurity, vaccination, in what sector, there's a lot that can be reduced. So I think that should be, if you talk about the time frame between short to mid-term, that should be the approach. And in the long term, of course, promote more and more or reduce dependence from the intensive systems for the long term.
Yeah. And that's where a lot of very interesting comments have been made on the possible alternatives. And I'm going to ask those people to just hold off. I'm going to come to it after the NDDB presentation. But before I move to the next three presentations, Haley, there's one specific question to you from Zambia. And I think I just lost the question. Yes, I think I would like you to respond to this. It is well recognized that poor quality antimicrobials can be a driver for antimicrobial resistance. This is a huge issue in LMCs like my country, Zambia. What effort is WHO and partners putting in place to curb circulation of substandard and falsified antimicrobial agents as a weapon against AMR? I think very critical issue that many of our countries face. Haley?
Yeah, thank you. I think that's important question. Quality of antimicrobials and affordability, of course, are critical tools to prevent and address drug resistance. And the rampant availability of poor quality and falsified medicines is a big challenge, and this goes also with the capacity of countries to put regulations in order to control this, and also making sure that the capacity also to address is also available. And that is also the role of regulatory bodies in countries, and also empowering them with the needed technical capacity as well as resources is critically important. So for the human health sector, what we actually now doing is looking into integrated antimicrobial stewardship activities. So we are actually currently developing a policy in order to make these integrated activities, including this quality of medicines, as one integral part of this policy package, which we hope will enable national authorities and governments actually to address this issue in a very holistic and comprehensive manner. Yes, it is a big problem.
Thank you, Haley. Keith, two things. One, your presentation that is not available, and people are asking for that. So if you can either send it to us, we will put it on the website. Sure. But I have a specific question for you. It's a direct question, and I think it deserves an answer. Why WHO, FAO, and OIE are not working on alternatives for antibiotics in primary health care of animals? Nowhere they are mentioning it in their regulations. So I think there is a concern that we need to deepen the advice that we are giving to farmers, to livestock owners, much more clearly. What are the possible ways ahead? Keith?
Wow, I love this question. Primary animal health care is for me the the absolute basis of where everything has to take place, and everything can change. So we've already mentioned some of the issues, that if the only healthcare is available by buying antimicrobials, then that's almost the default. Primary animal healthcare would be the access of persons to means to protect their own animals so that they can do it in advance of crises. I think the reason we're in this state is that around 30 to 40 years ago, we've tended to privatize the delivery of animal health care. And we said, if it's transboundary, if it moves across borders, that's public good. But if everything else, that's really for livestock producers for the market to solve. And what we've seen is that the market has become one that is of limited guidance and advice. So primary animal health care has not been high on our real agenda compared to bird flu and zoonotics and pandemics. But it's coming back to affect us. And so our agenda has to move back to primary animal health care as a discipline, as a necessity, and as a priority.
Wonderful. I have some very good comments that have been made. I'm going to ask people to hold off. I'm going to come back to it as soon as we discuss alternatives, because that's a very important part of today's discussion in terms of what are the possible alternatives for the livestock sector in particular. And we will come back to this. I'm now going to turn to my next three speakers who will give us the country view. I have from Zambia, Otrida Kampuna, who will now tell us what Zambia is doing, and then I will turn to Zimbabwe and Kerala. Otrida?
Thank you very much. Hello, everyone.
Hello.
My name's Kapona Otrida. I'm the AMR National Focal Point. I'm with the Zambia National Public Health Institute. I will give an overview of our National Action Plan implementation, but allow me first to start by very important today. Next slide, please. So as a country, we joined most of the countries in the world in responding to addressing antimicrobial resistance. We developed a multi-sectoral national action plan through a consultative process of all line ministries and cooperating partners. And this plan was launched in November of 2017 by 3 honorable ministers from Agriculture, Fisheries and Livestock, Environment, as well as Ministry of Health. Obviously, with support from our cooperating partners. Next slide. The focus areas for a national action plan are drawn from the global action plan. So we have raising of awareness, generating of evidence of data to support policy and practice, reducing the incidence of infection, as well as improving hygiene and biosecurity, 4, optimization of antimicrobial use in animals, plants, and humans. 5, investment in research and development. Next slide. So I'll quickly run through the status of implementation under each strategic objective. Objective number 1, we started with developing targeted awareness materials because of the need to raise awareness. AMR not being very popular, you agree with me that people know what multi-drug resistant TB is. They will have a bit of knowledge about resistance to antiretrovirals, but the concept of antimicrobial resistance itself and what it encompasses is something relatively new that most people do not understand. And this was highlighted in our situation analysis. And to respond to that, we developed targeted awareness materials with support from FAO. We embarked on an orientation of our media personnel and heads of different institutions. For the media personnel, obviously, we recognize the important role that media plays in information dissemination. So we brought them together to help us package this information in a way that will be simpler for the general public to understand. Working with the Zambia Medicines Regulatory Authority, we had sensitization of our aggravate dealers, again, because of the strategic positioning between the manufacturer and the end user. We did an assessment of value chain and production systems to identify high-risk behaviors. And this again was done by support from the FAO Fleming Fund Regional Project. We have drafted an internal communication strategy on awareness on AMR, raising awareness on AMR. We have had TV and radio programs, again, because of the relationship we now have with the media personnel. It's relatively easy for us to get these slots to go on radio or on TV and talk about AMR and have live phone-in programs that people can call in and ask questions and get clarifications. We have since 2017 joined the rest of the global community in commemorating World Antimicrobial now Awareness Week, and we have awareness campaigns. We target sensitization of different people, poultry farmers, it could be vet assistants, depending on the need at that particular time. We also introduce debates for universities on the Copper Belt and in Lusaka, and they get to debate live on TV on AMR related topics. Next slide, please. So the next few slides we can run through are just examples of the activities that I have talked about. Those are targeted awareness materials. The next slide. Orientation of our permanent secretaries. Next slide. The media orientation. Next slide. Sensitization of aggravate dealers. Next slide. Next one. That was a training for veterinary assistants in AMU. Some pictures from the live TV and radio interviews. Next slide. So last year, we decided to do something different. We introduced what we are calling the AMR Media Awards. And these are for our journalists who have been championing reporting and raising awareness and sensitizing our people on issues of antimicrobial resistance. So we partnered with MISA Institute of Southern Africa, and we hosted for the first time the AMR Media Awards, where we awarded individual journalists as well as media houses for their role. And this is basically to encourage them to report more on issues of antimicrobial resistance. Hopefully this can then trigger behavior change in our people. So we held the second media awards this year as part of also commemorating Antimicrobial Awareness Week. Next slide. Pictures for the commemorations and the debates. Next slide. Next slide, please. Objective number 2, strengthening knowledge and generating data for surveillance. So for the longest time, surveillance in antimicrobial resistance was mostly limited to the human health sector. It's recently that we have been building capacity in our labs across sectors to be able to do antimicrobial surveillance. And this has been complemented by the Fleming Fund country grant. Currently, we have 7 human health labs that we are supporting and 5 animal health labs that we're also supporting to generate local data to inform policy and practice. We have 3 labs currently enrolled into the Global Antimicrobial Resistance Surveillance System. We started with 1 lab in 2016. And in the past years, we have been building capacity in the other labs to get them to a level where they can generate reliable data. And depending on progress, we then enroll these sites to sentinel sites to contribute to both national data, but also data that we can submit to GLAS. We have done quite a number of assessments using the Atlas 2 as well as the modified WHO2 to assess the capacities of the labs to generate data, and then see the gaps that are there and see how we can then support these labs to address the gaps. We embarked on a mentorship program for on-site microbiology as well as quality management system. In microbiology, we have mentors going into these labs on-site for a period of between 10 to 14 days, taking the lab staff through the different microbiological processes, from sample reception, how you process, how you do correct streaking. We take them through correct media preparation, how you do your identification, how you do your antimicrobial susceptibility testing, all the way to result interpretation, result utilization. And you agree with me, because building microbiological capacity is an ongoing process. We do this every quarter, and we've been doing it for the past 2.5 years, after which we enrolled the 2 labs. So this has continued, and we have now increased to the 12 labs that we are currently supported, and these are both in the human health sector and in the animal health sector. Alongside these mentorship programs are quality management system mentorship programs. Unlike the classroom-based training or programs, these are meant to have the mentors tailor-make the mentorship package to suit the local context for the labs. And that's the difference. So we want to be able to build the quality management systems together with the staff to institutionalize these programs, but also instill that sense of ownership for the lab staff themselves. Next slide. In the animal health sector, for the longest time, there has been honey residue monitoring. There is a plan that has been implemented. We also have been submitting sales data to all IE on antimicrobials used in the animal health sector. ZAMRA has been doing post-marketing. ZAMRA is the Zambia Medicines Regulatory Authority. They've been doing post-marketing surveillance and pharmacovigilance. We have also been capturing import and export data that we have now inputted into our OneHealth AMR surveillance system, and this is meant to complement the AMR data that we are generating from the labs. The Zambia Environmental Management Agency has been also monitoring disposal of drugs from the different facilities. Next slide. So the next 4 or 5 slides we can skip through. These are just slides showing the different activities under surveillance that I have talked about. Okay, so what we have also done is to, maybe we can go back to the previous slide.
Can I ask you to wind up now, if you don't mind? I wanted to ask the other speakers to chip in, and then we can come back to the to this in questions.
Okay, so I'm actually concluding. So we did a prioritization of our national action plan. We realized that it wasn't realistic for us to implement all the things we had initially intended to implement. So with support from CSC, we reprioritized our national action plan, worked on our integrated AMR surveillance strategy. We did a roadmap for phasing out critically important antimicrobials in animals. And then we are now working on a drug take-back mechanism with ZEMA. So those are some of the things that we have been doing as a country to implement our national action plan. We can just go to the last slide, please.
Yes. Is this the slide you wanted?
No, the last one,
Sorry, this one, yes.
Okay, so we have had a few challenges, and these are challenges that I think are very common among developing countries, the issues of limited lab capacity, the issues of financing and all that. But in that, there are lessons that we have learned. We've learned to leverage on what's existing, building on what we can build, and working with the little resources that we have. And I think having prioritized our national activity, our AMR and AP activities has really helped us to maximize on the funding and implementation. In conclusion, they say it is important to have a sound idea, but the really important thing is the actual implementation. I think most of countries do have national action plans, but we realize that we've been lagging when it comes to implementation. And I think it's important that we rethink and re-strategize and see how best we can put these actions into plan if we are to win half the fight against antimicrobial resistance. Thank you very much for listening.
Thank you, Otrida. I think the biggest issue that you have raised is really how do we prioritize? And thank you so much for the collaboration that we have with you. And we're looking forward now to come up with the next phase of how do we work together to put, as you very correctly have said, how do we implement this? Because implementation is absolutely the key. Can I now ask Seki Zenyovera to speak? Seki Sai is the coordinator for the National Microbial Reference Laboratory in Zimbabwe. Seki Sai, can I now call upon you, please?
Can you put up my slides, please?
Sukanya? Yes, Rajeshwari.
Okay. So I'll talk about what we've done in the implementation. Can I have a slideshow?
Yes, Rajeshwari, can you put it on the slideshow on the bottom?
It's on the slideshow.
Okay, maybe it's not showing on the slideshow for all of us. It's showing as a...
Yes.
I'll do it once again.
Rajeshwari, just enable editing.
Sorry, Sukanya?
Just enable editing.
Okay. Is that okay?
Perfect. Yes. Is that okay?
Okay.
Yes, I think that is fine. So can I have the next slide? Okay, so we also launched our AMR National Action Plan in 2017. I think that was on the 17th of September in 2017, whereby we had all ministries like Minister of Health, Minister of Agriculture, and also Minister of Environment, including the
connectivity problems. See, this is where we are not realizing the digital age.
Representative from OIE, FAO representative, and also WHO. Next slide. So we first, of course, did a situation analysis to see what is on the ground before we actually got into the writing of our National Action Plan. Next slide. So we have a governance structure whereby the Minister of Health appoints within each ministry. And then we have our Zimbabwe AMR core group, and there's also an advisory committee, and then the 5 technical working groups that are in line with the Global Action Plan, like education and awareness, surveillance and research, hygiene and IPC and security, antimicrobial use and investment into research. Next slide. So in our AMR core group, there are many representatives from different sectors, different ministries, the Medicines Control Authority of Zimbabwe, the National Biotechnology Authority of Zimbabwe, the academia, we also have civil society, WHO, FAO, and OIE. Next slide. So, in order for us to also be able to implement our National Action Plan, we have tried to mobilize funding from the different organizations, because our own government, it was not yet, it was a new thing that has come in, but we're actually utilizing government resources that are actually available. So we managed to get 70,000 for the WHO advice from the WHO advisory group on integrated surveillance, so that we can implement a OneHealth surveillance system. And then we had a regional grant from the Fleming Fund of 25,000, and also on all the awareness weeks, we have always had support from WHO and FAO, and we have participated in the ASLM Regional Fleming Fund grant concerning mapping AMR and antimicrobial use partnership. We also are we are also now starting to implement the Fleming Fund country grant for an integrated surveillance system. And also ICAS is going to assist us on research. And at least now, we have finally put issues of AMR in our Ministry of Health strategic plan, so that it's incorporated already in the strategic plan of the ministry. Next slide. So the activities that we have so far undertaken, of course, the awareness campaigns, we've had dramas, going to the universities, radio and TV shows. So we've had public lectures at universities, newspaper articles on AMR, and also some art events. And this year, we said we want to do also something different, so that at least it's not things that are only just done during the week, but at least it stays in people. So we asked one of some artists to actually do a song on AMR, at least to also constantly be played on the radio. And also, we have also requested from school children, we did a competition that they must write a poem on AMR. We just gave them fact sheet on AMR, and 3 students actually won, having some really good poems. And we actually launched this yesterday, whereby different schools came, and those 3 actually said their poems to everybody who was actually there. So at least we wanted to also start from the grassroots, that school children should also now be participating in the awareness week, and that they also know that this exists. Next slide. And we've also given prizes to journalists that have also, that was the previous slide, but it does not matter, that have said more things concerning AMR, whether it's on radio or on the newspaper. We've given prizes to those that have done the best. And concerning IPC and biosecurity, there's a protocol that has been for surveillance of hospital-acquired infections that has been developed. And we've now had also HPV vaccination being done, and also cholera and typhoid vaccinations have also been taking place. Next slide. Concerning the surveillance system that I was talking about from AGISA, we actually saw that we are able to work together as a team to do a surveillance system that was OneHealth. So we actually did this particular project, which was actually successful, whereby specimens were being taken from abattoirs and from provincial labs and going to the Central Veterinary Lab that was for food animals. And then for food, specimens were taken from supermarkets and informal traders. For humans, we're taking specimens from different government hospitals, including some private hospitals, and also the environment. They were taking water samples and they were going to the different labs, and all results are coming to our National Coordinating Center, which was the National Microbiology Reference Lab. And we also did the surveillance on antimicrobial use, whereby our Medicines Control Authority of Zimbabwe was collecting antimicrobial use data for animals, and our Department of Pharmacy was collecting antimicrobial use data for humans. Next slide. So we actually saw that sensitivity patterns, ampicillin was showing the actually highest resistance. So for the different, we chose 2 organisms to deal with. That was actually Salmonella and E. coli. Next slide. And also concerning, we used import data concerning antimicrobial use. So for humans, we saw that cotrimoxazole and amoxicillin were the most imported medicines in Zimbabwe, and they were also those that were mostly used. Next slide. And then with the grants that were given, the 25,000, we said we would share it amongst the 5 technical working groups. And the education and awareness group, they gathered data for a communication strategy, because we realized that you need to communicate differently to different people. So the way you communicate to policymakers would be different to the way you would be communicating, whether to the public or to school children. So that's why we wanted to develop a communication strategy. Surveillance technical working group, we have a draft surveillance strategy that is present on how we're actually going to run our surveillances in the country. And then the IPC and biosecurity group, they held 3 workshops. And also the rational use group, they had stewardship meetings, and the innovative research, they had workshops concerning prioritizing which researches that we should actually carry out. Next slide.
Dr. Sisakai, can I ask you to, wind up quickly? I've really run out of time and I have 3 more speakers. So
okay.
I want to, and lots of good questions. So I want to give some time for discussion at the end.
That's right. Next slide. So the challenges we probably have been facing is that the coordinating mechanism needs to be strengthened, and all members in the core group have other jobs, so they are busy. And then we have no funding for the key activities within our National Action Plan. We don't have a policy document yet. And there's a shortage of human resources in the different ministries. Next slide. So lessons learned is that we can actually achieve activities as OneHealth. We've seen this when we do our awareness weeks and this WHO AGISA project. And then we have partners and UN agencies are supportive of the work that we do. Next slide. So right now we're going to be implementing the Fleming Fund country grant on integrated surveillance. So we want to have an AMR department within the ministry so that at least we are focused, not just having people that are doing AMR on a part-time basis, but to actually have a department. And then we are also completing a proposal from the Tripartite Multi-Partner Trust Fund. Next slide. Thank you very much.
Thank you, Sisakai. Thank you so much for this. This is very interesting, and I would now turn to Dr. Sudhi. Sharda Devi from the Government College in Trivandrum, Thiruvananthapuram, to talk about the Kerala experience. Sorry, is there something up? Is there a technical glitch? Sukanya?
Yes. Yeah, now I think now it's fine.
It's fine now. Yes. Dr. Sarada Devi, can I ask you to rush it a little bit? I'm sorry, I've been a very bad chairperson, but a moderator, not a chairperson, very bad. So can I ask you to keep to 10 minutes, please? Dr. Devi? Are you on mute? I know that you are not putting on your video, but are you on mute, or we can't hear you? Hello? No, I'm afraid your connection is very bad because we can't hear you. We can only see your slides. And now better. A little louder. Can you try that again? No. Sorry. Sukanya, can you just check with Dr. Devi? Is it possible? Should I move to the next and then come back to her?
Sunita, I'll check.
Can you check? Maybe we can ask her to put this off. I will now turn then to, I don't want to lose any time because I'm very conscious of the fact that we still not only have to every speaker has been good, but we also have some very interesting comments which I want to spend some time on. So should I move to Will?
Yes, ma'am.
Can I do that, and can you tell her? Will, can I ask you to come in and talk about the environmental action, the action to contain environmental AMR? Will Gaze, who's at the University of Exeter Medical College in UK. Will?
Oh, right. Can you see my?
Yes, we can. Can you just move it to the full slide? Yes. Perfect.
Okay. So I'm going to take a little bit of a change in step now. Firstly, thank you very much for inviting me to speak to you. So I'm going to talk about the need for action to contain environmental AMR, but stressing that really we're talking about the environmental dimension of AMR, not AMR in the environment. Because I think sometimes talking about AMR in the environment makes it sound like it's something discrete or different from AMR that affects humans and animals, and it really isn't.
Yeah.
So there are three main issues that have been identified by successive action plans, including the EU AMR OneHealth Action Plan and the WHO. So firstly, there's the role of pharmaceuticals in the environment driving emergence of AMR. So that's the chemicals, the antibiotics, the biocides, heavy metals, these co-selecting agents, as well as the antibiotics that can drive emergence. And this recognizes the fact that AMR can come from the environment. So there are these genes that are in environmental bacteria that can emerge in human pathogens. There's a circulation of AMR in the environment, which is really around these pollution sources we've heard about before, which that can be involved in transmission. And then there's transmission itself. So what is the evidence for environmental transmission to humans and animals? So firstly, antibiotic resistance is not new. It's been around for millions, if not billions of years. So this figure just shows that if you look in 30,000-year-old permafrost, which is sort of the same type of era as when mammoths were roaming the plains of Russia, that we can actually see that there are frozen bacteria in that 30,000-year-old soil that possess resistance to modern antibiotics. And we know from molecular phylogenetic analysis of resistance genes that even closely related resistance genes have been shown that they may have diverged, millions of years ago, say 20 million years ago. So this is not a new thing. But what we've done is, of course, accelerate the rate. And I think when you think about environment, you can split this up into two different phenomena. So there is this emergence of resistance genes, as I just mentioned, that have evolved over evolutionary time, most of them of which are not in pathogens. And these are in these indigenous environmental bacteria, and these can be transferred to exotic bacteria in the environment, which are those that are introduced, so human and animal associated. And these are two bacteria here conjugating, where genetic material is passed between them. And there's some very good examples, say, such as the BLAST-CTXM genes and the fluoroquinolone resistance genes that have been shown to come from environmental bacteria. The second thing, of course, is the acute transmission events. So this is where you might be exposed, a person might be exposed to an existing AMR pathogen, which is contained in human or animal waste. So you can think of it in two different ways, really. And this OneHealth idea of AMR is not new. And I came across this diagram in a paper by Linton from 1977, so over 40 years old. And here we can see antimicrobial resistant bacteria in animals, in humans, and then showing these transmission pathways in the environment, so rivers and streams, sewage. And even here we have these are the selective pressures. So the only thing missing from this 43-year-old overview of OneHealth AMR is the fact that there aren't any selective arrows in the environment, which we now know there are, of course. So really, it shows we haven't really come that far in 40 years, which is disappointing. But we must remember that we do have a lot more evidence now. Whether that is really now filtering through into policy, it's a slow process. So I'm going to talk quickly about those three different issues. So the role of pharmaceuticals in the environment. So we know that we can find antibiotics in water, for example, in river water, and they're there from high nanogram to low microgram per litre. This is just a study which is looking at selection for antibiotic resistance at very low concentrations. So traditionally, we thought that resistance evolves between the MIC of susceptible bacteria and the MIC of resistant bacteria. But now we find actually there's this sub-MIC selection window where the resistant bacteria just grow faster than the susceptible ones. The susceptible ones aren't killed, but they grow more slowly. And where the growth rates of the resistant susceptible cross is termed the minimal selective concentration. And this can be as low as 1 milligram per litre or down as low as 100 nanograms per litre for ciprofloxacin. So these are really low, and these are in the range that we find in the environment. So we've been doing work where we do the same thing as was done by the other authors, but they did it with single species. We do it with mixed populations of bacteria that carry all of those different resistance genes that we find in the metagenome. And this slide basically shows that if we compare the minimal selective concentrations to the measured environmental concentrations, and if you divide the measured environmental concentrations by that predicted no effect concentration, you get a risk quotient. So this is increasing concentrations in the environment, and this traffic light system shows for these antibiotics where we think resistance will be selected for. So basically it shows in circles, this is the maximum environmental concentrations recorded in high-income countries predominantly. And you can see that all of these different classes either have a high risk of selection. So this is ciprofloxacin, cefotaxime, trimethoprim, or sort of intermediate when we look at azithromycin or clarithromycin. But at the median concentration, then it's only really that the fluoroquinolones appear to be highly selective. But it depends really on how you generate this minimal selective concentration data, and this is an emerging area of science. So if we think about circulation within the environment, this is another study that we've done in a high-income country, so in the UK. This is in the Thames River catchment. So we looked at multiple sample sites for a marker of resistance, in this case an integron, which is a mobile element that can integrate resistance. And we looked at 4 different time periods over 2 years. We see that some sample sites, the marker for resistance is always low. Sometimes it's always high. So why is this? When we did some really simple statistical modeling, we found that we could actually predict over 80% of the variation in this marker for resistance. And when we looked at what was behind that variation, we could see that 50% was explained by point source pollution. So that's wastewater effluent going into rivers, in this case, mostly treated, but still having a really significant impact on AMR and the environment. And 30% of the variance we could detect was to do with the land use around that sample site. So whether it was agricultural land with grazing animals or whatever. So basically, even in a high income country where we have most of the wastewater, the sewage is treated, we see dramatic impacts on the AMR in the environment. And we know the same is true all over the world. And that will be exacerbated, of course, when you have different levels of sewage treatment, for example. And then lastly, moving on to environmental transmission. So what is the evidence for that? Many of you might be aware of this really, I think, a very significant paper by Peter Collignon, including Tim Walsh and Sumanth Gandra and Ramanand Lakshmanarian, basically looking at sort of global trends of different anthropological and socio-economic factors and how they correlate with resistance. And this is a bit small, but essentially this is increasing resistance in this axis. And this is the amount of antibiotics used in daily dose. And you can see as the amount of antibiotic increases, resistance does not increase. So there is no correlation between AMU and AMR on a global scale. And actually, again, this is too small. I'm sorry, I didn't realize it would probably look this small, but really this is showing that they identified that it's things like, it's the infrastructure index, it's the sort of amount of money that's spent on sanitation and things like that that appears to be really driving increased resistance. So they say it's surprising. We found that antibiotic consumption was poorly correlated with antimicrobial resistance, and they suggest that it's more likely to be due to dissemination of antimicrobial resistance in the environment, especially via poor sanitation and contaminated potable water. So I think this is a really important study. And just again, we always talk about these differences between low and high income countries. And I think the same processes occur all over the world. It's just the magnitude of those different drivers. So this is just 2 papers that from my own group, where we looked at human exposure in coastal bathing waters in the UK. And we estimated that over 6 million exposure events every year just to one type of resistant E. coli. And when we looked at highly exposed user groups, in this case, surfers, we found that they were more likely to be colonized by ESBL producing E. coli. And we know that if we did the same type of studies, and those studies are being done and have been done in other parts of the world, we see the same thing. So in summary, evidence suggests that selection for AMR at subtherapeutic concentrations happens in animal, human, and environmental compartments. Most antibiotics end up in the environment. 70% are excreted by humans and animals. So we tend to think of it, not being a significant area for selection, but most ends up in the environment where there's mixing of bacteria from all different sources. AMR in the environment correlates with pollution sources, and there's a significant evidence of transmission of AMR associated with WASH in low and high income countries. So my final slide, we need more accurate data on these concentrations of single compounds and complex mixtures to understand the selection for resistance in the environment. We need models to predict emergence and evolution of resistance. We need to understand the extent of this acute risk of environmental transmission. And we need to prioritize using sort of cost-benefit analysis, maybe, the interventions and mitigation strategies that we need to put in place to reduce evolution and transmission. Okay, thank you very much.
Thank you, Will. I think that gives us a very, very good perspective on where we stand. I will now ask Girish Sharma, who's the Officer on Special Duty at NDTV, to speak to us. And Girish, it's very interesting the kind of efforts that you're making on ethno-veterinary herbal practices, and there are a number of comments we've got as well on it. So I think we are all looking forward to hearing from you on this. It also feeds into what we heard earlier from FAO on the need for alternatives.
Thank you. I'm trying to make it full screen, but I'm not able to do it.
I think it's full screen now.
Okay.
Please go ahead. It's fine. Yeah.
So, good afternoon, all. And thank you, CSE, for organizing this webinar and inviting NDDB to share our experiences. So, I mean, although there is a very lengthy definition of what EVM is or ethno-veterinary medicine is, but for general understanding, ethno-veterinary medicine is a compilation of people's traditional practices and knowledge, which we say wisdom, and beliefs to keep their animals healthy, productive, and performing using local resources. So it is not something we use which is not locally available in a sustainable manner. So this is in a nutshell what EVM is all about. So it is not some formulation which is exotic to people. They know, and it is passed on from ages, available. The only thing we need to harness this. Now, at some point of time, some 5 years back, maybe 6 years back, NDDB was looking at how to reduce the cost of milk production. And one of the major input at that time was animal health intervention. So then we thought that, okay, if the NDDB has to start working on something, which area it should work on? Because you've got varieties of diseases and ailments. Now, NDDB has also developed a system, information system, which we say information network on animal productivity and health, enough. And few cooperative unions were using it for the health area. And all the diseases which they encountered and for which the veterinarians went to treat them, it was all entered. So from that, it all emerged that the majority of the diseases are of udder, for which a veterinarian was called, which was followed by digestive and general diseases where fever and anorexia and then reproduction and all that. So then it became clear to us that, okay, if you want to do intervention and if you want to do something, the major thing where it would have impact is the udder. And in the udder, obviously, when we started looking into it, it was mastitis. So mastitis became important thing for NDDB to start working on. What do you want to do? Because antibiotics are available, everybody was using it. Now, all of us know that the initial stage of mastitis is subclinical mastitis, and then either it recovers or it progresses into mastitis. And at both the stages, subclinical is usually not detected, and in clinical, largely the treatment is only antibiotics. So then we said that, okay, let us first try to put in place a system by which subclinical mastitis can be detected and if it can be treated. So we put in place a mechanism where pooled milk sample, which farmers bring to the cooperative society, because we work only with the cooperative societies, we don't work with the private dairies. So when they bring milk, the sample is drawn at the village level and it is tested by CMT. And if the sample is positive, farmer may have 2 or 3 animals, it may have only 1 animal. So because it is a pooled, so we do not know which of these animals. So then you go back and you test the animal. When you test the animal, and then you come to know which animal is suffering, and then you give for 10 days 10 grams of trisodium citrate, which is not a antibiotic. The trisodium citrate has been used quite long. From 70s it has been used, seems to be working. And then if it doesn't work out, then you repeat it for another 10 days. Costs around 20 rupees for 10 days. So it is not very expensive. So this is what was the thought initially. And then we were surprised with the recovery. So when we are talking about, we are not talking about very small number of cases. Now look at it. Here it is more than 7 lakh animals whose samples were drawn. And we found by TSC's implementation in subclinical mastitis about 69.99% recovery, which is very good. We published this in Indian Dairyman. And for those animals which did not recover, then second dosing of TSC was done. Then the recovery became 89%. So that means in those cases where if you are able to detect mastitis early or subclinical mastitis and you treat with something other than antibiotic, so you are avoiding the usage of antibiotics. If you avoid the use of antibiotics, obviously you are looking into the reduction in the antibiotic residues as well as emergence of resistance. We also found 10 to 15% milk enhancement in the production, and use of antibiotic was avoided. So this was for subclinical mastitis, but not that everything and every farmer followed it. So then came EVM, ethnoveterinary medicine, and our knowledge in ethnoveterinary medicine was very limited. Whatever we gained was in collaboration with TDU. This is a transdisciplinary university in Bangalore. They are very good setup. They've got eminent people. We worked with them. They advised us what to do and how to go about. And actually, we were only the catalyst. The real work was done by the cooperative union, which is there in Sabar, where we started, Sabarkantha in Gujarat. So we only brought together the experts from TDU and the people in the field who did. So the veterinarians from there were trained at TDU. TDU professors were there with them. And then we started working. So the recipe was very simple. It required aloe vera, haldi or curcuma longa, calcium hydroxide or lime or citrus lemon. So these 3-4 things put together and you apply on the affected udder. So there were two kind of preparations. One was water-based, another was oil-based. Oil-based required less repetition of application, but water-based required more. But you look at it, it is more than 67,000 cases initially, and we had 85% clinical recovery. Now, whenever we are seeing recovery, either in subclinical or in clinical mastitis, it is clinical recovery. We do not know whether bacteria is still inside or not, but we know the inflammation was there, milk was curdling, it was not giving milk, it was painful. Now it is not the case. We have a facility. Hello. Are you able to listen?
Yes, Girishji, please go ahead. I think somebody's phone has come in, but please go ahead.
Okay. So we have a laboratory at Hyderabad which works on AMR. I'm not going to confuse you with those results, but what I'm trying to say is that we isolated a lot of AMR bacteria from these mastitis cases, but after giving this treatment, even in AMR bacteria, there was a recovery. So that means where antibiotics are not working, in some of those cases, EVM is working.
Wow.
So that probably is something that we should keep in mind, that if we can handle as many cases by EVM, more and more we are trying to avoid usage of antibiotics. So after having worked in this particular area, Sabarkantha, for about 2 years, NDDB decided that, okay, this is good enough experience and let us try to popularize it. So then in the next phase, what we call mastitis control popularization project, we went around, we went to 9 states, 24 milk unions, more than 15,000 cooperative societies. We brought those people, we trained them, some of them we sent to TDU, because you train certain people, they become trainers, they train others, and then finally it goes around. So this is going on for last 3 years. More than 92,000 cases have been treated. Recovery is around 79 to 80%. So if we are looking at those kind of numbers, so again, as I said before, we are not talking about 10, 20 or 50 people cases. We are talking about 90,000 cases or 80,000 cases. So these are very good numbers. And this should instill confidence in everybody that this is something which is that, this is something which is available. It doesn't require anything great, a lot of budget and all that. What it requires only motivating people and then trying to tell them that this is something work. So we bring people first to those areas where people have been following it, and farmer learn more by working and talking with farmers. So after having done this, then we started using EVM again with the help of TDU for other ailments, which were quite common, like diarrhea, fever, indigestion, any stress, worm infestation, parasites, and all that. And everywhere you see the recovery is between 70 to 80%, 85%, and such like. Now we have a system, online system, in which every single animal where we are talking about, they are all ear tagged. We know when the treatment started, when it recovered, what was the thing before, how many dosing. So all those details are available. So it is not just like this number thrown around. So since 1617, more than 6,150 animal husbandry personnel have been trained. More than 3.61 lakh cases have been recorded. And in all the unions and such like 378, demonstration plots have been developed, where different kinds of, these herbs and plants, they have been put in so that farmers can know, and then from this nursery they can take and put the sapling there. So in total, if you look at in mastitis case, about 1.17 lakh so far, out of which 79% recovery. And in other ailments, where we say other means fever, diarrhea, and other, so it is 2.44 lakh, out of which 82% recovery. This is our clinical recovery. So what we have found that EVM is very effective. So for that, we have developed a lot of extension and training material. There are videos for every single ailment which is treated with the EVM. They have been translated into 14 different languages. They are all on YouTube. We have made a lot of brochures. We have farmers training program in which there is a specific module on it. So everywhere we talk about, we take EVM along. We have done the publications in international forums. Recently, we have published Indian Journal of Dairy Science, Ethnoveterinary Medicine for Responsible Dairying. So it gives a lot of details about our experience and more numbers and more data and more references. So if anybody of you are interested, please, my email is there. We'll see that if we can share with you.
Thank you. Fascinating. Really fascinating.
In conclusion, I will say EVM is effective, farmer-friendly, affordable, sustainable, environmental friendly. But EVM requires popularization. It requires mainstreaming and focus. And it requires certain research on formulations. And this is our team. And we would like to acknowledge TDU and all the participating cooperative unions, because ultimately they are doing, it is their data. We are only putting that data in front of you. Thank you very much.
Thank you, Girishji. Thank you. Fascinating. Really fascinating to see also the rigor with which you have gone about putting this data and the analysis together. So it's no longer anecdotal. It's actually hard evidence that we can draw upon. That's so important when you try and build change. So thank you so much. Rajeshwari, I understand that Dr. Devi has connectivity issues. My own suggestion is that instead of running through her presentation and not doing justice to it, let's put it on the website, and we will do another workshop really looking at the Kerala experience at some point, because I think we've both run out of time, but also I don't want to rush through something which is so important. So with that said, what I want to do now is to really just discuss if there have been a lot of questions that I have, and I know that today was a tough day, so we may have lost some of the panelists. I'm just wondering, is Keith there at all? Keith, are you?
No, Sunita.
He has left. Well, understand it's the week. And so as he said, he has back-to-back events. But I think what I would then do is to really wrap up today and to give what I think is a very important presentations of today in terms of how we move ahead. I mean, what is very clear today is that this issue is on the table. What we need to also take back is that it is no longer an issue of the developed countries, where the rich countries are talking about AMR. Actually, what is very important to talk about so much more clearly is that we all understand the importance of AMR, whether it is in countries where access is still an issue or in countries where it is about excess. So we know that we need access to basic medicines, but we also know that we need to make sure that we can um, handle the problem of misuse, handle the problem of overuse today. And I think that's a very, very important message that the whole global community needs to understand, that we are part of this effort to try and stop um, antibiotic misuse. The second thing that has come out is it's clear that the livestock sector, the environment sector are two very important pathways. But what is also clear is that we need a rethink when it comes to the livestock sector. We will look forward to our interactions further with with FAO and with other agencies. But it's clear to me that the issue is not just about poor countries and about animal diseases, which are clearly important from livelihood of livestock owners, from pastoralists, from farmers. I mean, it is very clear that animal diseases is crippling for the owners of those livestock. But it is also very clear that the misuse of antibiotics is not happening just in this sector, but in the larger chemical overuse, agricultural system, which is an industrial agricultural system. And it's clearly that sector that we also need to influence, because that is driving the massive amount of overuse of antibiotics in our food that we eat. But that connected is also very clear that we need to have alternatives, because if we want to move ahead, we will have to give farmers viable alternatives. And this is where the work that NDDB has done, and I did see on the comments some very interesting comments from others who have explained the work that they have done on the issue of medicines and ethno-veterinary practices. And I think that's critical, and that's going to be a very much part of the future, learning those and amplifying them and infusing them also with the modern practices that we have, both in India as well as in Africa, because it's clearly going to be the agenda of learning from farmers and not just giving them what we believe is best. And that's where the final big question comes in. The point that Will raised, the point that many others have raised, is the preventive agenda, that we need to talk about preventive. We have constantly said in our world that we are too poor a country to first pollute and then clean up. When we discuss the issue of antibiotic contamination in groundwater, we constantly raise the point to say, listen, we can't first contaminate groundwater and then think of cleaning it up. We just don't have the ability. And that was pesticide. Today, we are talking about antibiotic resistance, antimicrobial resistance. And it's clearly so much more important to talk about the preventive agenda here. The preventive agenda when it comes to sanitation, the preventive agenda when it comes to clean water, the preventive agenda when it comes to issues of good animal care practices. I mean, we need to move out of the industrial, agricultural and poultry systems and livestock rearing systems, which actually force the use of more chemicals, because that's the only way that you can prevent disease and get productivity. So we need to look at the AMR agenda very much as what my colleagues Amit and Rajeshwari said right at the beginning, connect the AMR agenda to the issue of how we grow food, how and what we eat, how we manage the environment. I think that agenda is what is also a very exciting agenda, because that's where the opportunities for the future will be. So once again, thank you so much for joining us. We are 10 minutes over time. In fact, we are almost 40 minutes over time, because initially we had talked about doing it for 1.5 hours, but we had some excellent speakers. So we wanted to make sure that we could spend some time together to discuss all the different elements. And I hope all of you will agree that we have learned, and we have learned a lot. I had a wonderful comment, something that, there are comments on the side which often touch you. And one of the comments which I think I have lost now was from Bahamas. If I can find it, I would ask you all to read it, because that's really the kind of thing that why we are doing this. Yes, it was from Dr. Hassan from the Bahamas, Department of Agriculture Veterinary Services Unit. And Dr. Hassan is talking about how he is working on this also in Bahamas, and that how all this will help him to also implement it. Well, that's really, when I read this, Dr. Hassan, so thank you so much for sharing it. This makes all the work we do so much more meaningful. So thank you so much for saying this, and we will hope that we will keep doing this, keep raising the issues, because clearly this is the silent pandemic that we cannot afford to ignore. Thank you again for joining me, and thank you for your presentations.